Pacific Oral Health Society was conceived as a non-profit organization to help really in three main areas of dentistry in the Lower Mainland. One is to provide dental service for people who have a hard time paying for it, people who are financially challenged, people who maybe have limited funds for dentistry.
There's a tremendous need for this type of service. A lot of people are without dental insurance, they're between jobs, they're between benefit plans, and we're just seeing an awful lot of grief out there. So we see a variety of patients coming in here. Some of them are pensioners who just can't stretch their pension dollar far enough to include dentistry. Sometimes it's young mums. At a recent event, we had a lady come up and she was an articulate, fine woman, and she said, I'm a good person. She said, I have two teenage boys, I make $12 an hour, I pay $600 a month rent. She said, there's not a nickel left over. She said, if it wasn't for this event, my kids couldn't see a dentist. Those are the kind of people we're helping here today.
When we opened the door and people were even lining up before I showed up in my clinic. And that was kind of an eye-opener for me. I think I just touched the tip of the iceberg on that day because there's a huge problem underneath.
Right now, only about 20% of patients regularly see the dentist, so there's a large number of people who aren't seeking regular dental care. There's been a real neglect on the part of a lot of people for regular dental examinations, and so they only get the symptomatic care. They go to the hospital when they have a pain, they go to the emergency room, and in most emergency rooms in the province, there is no dentist, so all you get are antibiotics and painkillers, and you're told to see a dentist. Well, if you don't have a dentist, what do you do? And I think Pacific Oral Health Care can meet that need at two levels. One is to get patients so they have continuous oral health care so they don't have these acute problems. And the second is to give them the right care when they need an acute incident treated and take that away from the hospital where there aren't any dentists to take care of it.
It gives an opportunity for people that cannot afford to go to the dentist, an opportunity to make sure that they have good oral care. And so when you look at people that are less fortunate than ourselves, it's a really good opportunity to make sure that they have the same benefits that we do.